This is For Your Health with Dr. LaBeau. June 6th is National Cancer Survivors Day. And today we're going to talk about how you can be a cancer survivor with cancer supportive therapy. It's hard not to know someone who's not been affected with cancer, especially since cancer is the second leading cause of death after heart disease. Additionally, the longer we live, the increased incidence of cancer for every decade that we live. One of the things that's been found in some of the chromosome and genetic studies is that though our genes are fixed, like this model over here is an example of a rock on the seashore, optimal diet and lifestyle overshadows those chromosomes and genes, whereas less optimal diet and lifestyle allows those genes and chromosomes to be expressed. So we're going to talk about how to suppress, how to keep that health robust so that you can suppress those natural tendencies of dis-ease in your body. So first we're going to talk about diet. Diet is the foundation of wellness medicine. An example of a good optimal diet is when you're shopping, you want to shop around the store where you're getting primarily whole foods and what I consider a vegetable-centered diet being the optimal whole food diet. Whereas when you're in the middle of the store, you tend to get more processed foods where when you read the labels, you feel like you're more in chemistry class than biology class. Next, exercise is helpful for circulating the body, nutrients, for getting oxygen. Here I recommend 20 to 30 minutes a day or an hour 3 times a week. And thirdly, sleep. Granted, our schedules are erratic, a lot of things going on, but the more that we get 6 to 8 hours of sleep, and rested sleep is what's really important, not just time in bed, the better we find that our overall health will be. When it comes to standard therapy for cancer, we're talking about surgery, radiation, and chemotherapy. They're excellent at killing tumor cells, but they don't prevent reoccurrence and oftentimes are toxic, especially with chemotherapy and radiation therapy. Now, with cancer supportive therapy, we're looking first at that foundation of diet. And here I use a modified Mediterranean diet where I further eliminate any of the carbohydrates, trans fats in the diet as much as possible. Next, I look at herbal and nutrients that are helpful and beneficial for an individual's particular type of cancer. So it's tailored both to the type and the amount of cancer the individual has. Third, I'll evaluate overall nutritional status, and I'll look at a couple dozen key vitamins and minerals. Having adequate nutrients in the system is paramount for supporting your immune system to participate in the fight, as well as to deal with some of the toxicities that either you've been exposed to from the cancer therapy or possibly even part of the reason why you caught cancer with some environmental toxins, heavy metals, chemicals that you might have been exposed to from the environment. So in conclusion, the sooner you can incorporate cancer supportive therapy, the better the chances you'll be of being a cancer survivor. And even better yet, for optimal health and cancer prevention, why don't you schedule a wellness visit where we can review your overall health and do some specific nutritional testing to see if you have the nutrients necessary for optimal health. And this is Dr. LaBeau with For Your Health.